Good morning and welcome to all of you. Thank you for joining us here at Howard County General Hospital, our community hospital. As we continue to navigate through the long-term effects of the COVID-19 pandemic, the importance of having access to quality mental and behavioral health care is more important than ever. We know that there is a great need to invest in and expand our behavioral health infrastructure here in Howard County. The Maryland Hospital Association reports that hospital visits for behavioral health increased from approximately 10.5% in 2013 to over 18% in 2021, and we anticipate that those numbers may continue to rise. However, behavioral health care service for individuals who are experiencing an emergency are currently very limited across our county. As a community, we must continue to invest in preventative care and behavioral health infrastructure to ensure that every resident has the resources and care they need to live a healthy and supported life. To address our behavioral health care needs in Howard County today, I'm announcing a combined $2.5 million in county funding to expand our current healthcare facilities to meet this growing need. This funding includes $1 million that will support critical investments in the behavioral health care unit right here at Howard County General Hospital. This investment will enable the hospital to proceed with a new 7,000 square foot behavioral health unit. This new unit will increase the current 5-bed facility to a total of 24 beds in the unit. This investment will ease overcrowding in the hospital and ensure that more of our neighbors are able to receive timely and supportive care in an environment that supports them becoming their very best selves. This county commitment is joined by $1.6 million in state funding for the hospital's behavioral health unit. I want to thank Senator Clarence Lamb, who you'll be hearing from in a little bit, for his advocacy in the state, not just as a legislator, but as a doctor who is willing to run to the front lines whenever needed. In addition to addressing our emergency needs here at Howard County General, I'm committing $1 million in funding towards renovating Sheppard Pratt's residential crisis program in Elkridge. These funds will help create a 16-bed residential crisis program, diverting residents away from the emergency room and ensuring that county residents get the right level of care they need at the right time. This county funding is also joined by $1.6 million in state funding to support Sheppard Pratt's residential crisis program. Furthermore, I'm thrilled to announce a commitment of $500,000 in funding to Turk House for the creation of a new residential treatment facility in Highland for people recovering from substance abuse disorder. This facility will be specifically focused on supporting pregnant women and women with children, which is currently an unmet need in our continuum of care. I want to take a moment to thank the hospital, Sheppard Pratt, and Turk House for their continued commitment and partnership in working to provide life-saving healthcare services here in Howard County. I also want to thank again Senator Clarence Lamb, but frankly our entire state delegation, many of whom are here, for recognizing the needs and making them a priority in the state budget. With this investment of county and state funding, we are building on our efforts to support all of our neighbors who are experiencing mental and behavioral health care crises here in Howard County. And finally, I want to thank the County Council for their consideration of this needed funding in my proposed budget, as well as their continued partnership in serving our residents. We have some council members here who you'll hear from soon. These partnerships make clear that when we work together, address issues strategically, and take a truly holistic approach, we will save lives and help build a healthier future for all. Thank you.
So it's a real pleasure on behalf of the Howard County delegation, our House Chair, Delegate Courtney Watson, myself as the Senate Chair. What the county executive really cited was true, that it's a true partnership. It's a partnership between local government and state government. In a few seconds, I'll highlight what the state government's been doing through a lot of the leadership of my colleagues as well. But this is a very real problem. So as a physician, I still see patients. And just even yesterday in clinic, I saw a patient who was being cleared to return to work after having to go on short-term disability for 3 months. And when I asked him why he took leave, he said it was because of depression and anxiety, both at the workplace and at home in his personal life. And he came back to work after 3 months, not necessarily because he felt ready to be back, but because his short-term disability was running out. And when he first got into work yesterday morning, he was staring at 5,000 emails from the time that he had been away on leave. And so we talked about coping mechanisms and accommodations that could be made to lessen the stress in the workplace and to continue work with his therapist for treatment outside of the workplace. But he's just one of thousands of county residents who face depression, anxiety, and other behavioral health challenges every single day. In fact, according to a 2021 study, 35% of county residents reported feeling depressed, anxious, or lonely. And the pandemic necessitated not only social distancing, but also exacerbated growing social isolation, which has led to many concerns amongst our community when it comes to their behavioral health needs. And it's not only amongst adults, but it's also in our schools, where in 2018, a Howard County survey found that 28% of high school students felt sad or hopeless for 2 weeks or more, and 1 in 6 high school students seriously considered attempting suicide. So I commend efforts that are being undertaken by our county in partnership with the school system. Last year, expanded school-based mental health needs, and the expansion of services this year will continue to support our community through really challenging times. The state, through the General Assembly session that just wrapped up, also provided additional support for mental and behavioral health needs. This past session, we fully funded the 988 crisis hotline with an additional $12 million per year. We certainly worthy of applause there. We extended collaborative care between primary and behavioral care health providers. We expanded wraparound services for children and youth who are most at risk, and I think that's actually Senator Hester's bill that passed into law. We created systems for comprehensive community behavioral health clinics, preserved affordable access to telehealth services, allowed creative health care for the highest need patients when it comes to 21st century behavioral health delivery system expansion. So I want to applaud the work of our county executive under Dr. Calvin Ball, the support of the county council, and our community partners like Howard County General Hospital under the leadership of Dr. Ahmed, and our health department led by Dr. Rossman, and as well as our community partners like Turk House and Horizon Foundation, all of whom come together in partnership to support this important need for our community. So with that, I want to thank all of you for being here. This support is tremendous for our local community partners as we, on the state level, work with our local partners as well as our nonprofit community to help support important behavioral health needs throughout our community. Thank you on behalf of the delegation, and we applaud your continued work on this effort.
I'm here on behalf of the County Council, and I'm really here to bring greetings. But as I stand here in this place, I'm really reminded of a few of the behavioral health challenges that I've experienced in my life. Mainly because I was cared for and supported at this hospital. So as a teenager, I got support from Howard County General. Then after the birth of my first child, I started experiencing postpartum depression, but didn't even really understand it until months into experiencing it. And I gave birth to my daughter and my second child here as well. And I say that and I share that because I'm a member of our community and I'm just one of the 300,000 of us. And we're all going through something all at different times. And it's imperative that we have the services and spaces to support our residents in need. Because without these, There is simply, it is just falling into an abyss. And that's what it feels like without these services and these spaces. So I truly want to thank all of the community partners who've come together today to provide these spaces and these services, because without leadership like this, we don't have them, and our residents are left without that support. So this is what it means to come together as a community and create those solutions. So thank you everybody here for your work today.
Welcome to the 4th District, the beating heart of our 4th District. And I also have been had the pleasure of using this hospital to give birth to my daughter, which is always a wonderful memory. And my husband's life was saved here. So I have very warm feelings about Howard County General. And in the behavioral health area, there were a number of us who met with Dr. Ahmed last December. I know the state delegation was mostly there, and some of the council members. And I took a tour of the new behavioral health floor that is going to be renovated with this money. And it will really help our community to have these beds available. Between Shepherd Pratt and Howard County General, we'll now have 40 beds. That's a lot of beds. Thank you, State of Maryland, and our own county taxpayers, because this is really important to our community, to make sure that we're dealing with our mental health needs, and also to open up some of the beds in the emergency room so that the people who also need that emergency care will be able to use those beds, while people who have the behavioral health problems will be able to use the new beds that we have here at Howard County General. And I can't leave without saying, and Turk House is also in my district, so we are looking at a lot of new behavioral health facilities and services, and thankful to everybody who is going to make those things actually happen for us.
Thank you very much. And I just want to start by thanking our county executive and county government and all of our state representatives for their generous support of the behavioral health needs of this community. As you've heard from the two previous speakers, this is something that includes all of us. None of us are excluded from mental health care. None of us are excluded from hospital care. It's a very important thing to support. I know that there are limited resources and many worthy requests for this kind of financial support, so I'm incredibly grateful that this is one of them. Howard County General Hospital, along with other hospitals throughout the country, are seeing dramatic increases in mental health visits. Statewide, more than 18% of hospital visits to the emergency department in 2021 were for behavioral health. That's compared to 10% in 2013. So we are seeing the need increase over time. While we have dedicated behavioral health unit capacity within our emergency department, it currently only has capacity for 6 patients. But on average, on a daily basis, we see about 11 patients who have this need. So those other 5 patients are in our traditional beds within the emergency department, which is only 36 beds. And they have a longer stay, and they have a different challenge. And in order to meet those challenges, this department is being renovated. On most days, the emergency department is not the ideal environment for these patients. When you're experiencing a mental health crisis, you need to be in a unit that supports those things, not necessarily our regular emergency department, which supports other issues. And to address this challenge, we are dedicating this new area and increasing, as you have heard, up to 24 spaces for mental health capacity, given the needs. And we many days do see these needs. The new unit will provide not only an expanded space physically, it's close to 4 times the size of the current unit, but it's a much safer and a much more conducive environment for healing, which is what we ultimately want for our community members. Additionally, it's our hope that by increasing this capacity for behavioral health, we will in addition increase our ability to care for our traditional medical patients in the emergency department and help increase that access that is also so sorely needed. The full cost of this unit is approximately $9 million. So the additional $1 million in funding from the county helps significantly. We are currently working with our community to continue to raise the rest of the funds that are needed, and we appreciate everybody's support. So thank you again, Dr. Ball, for all of your wonderful support, and thank you to everybody here today.
It's an honor to be here today and represent Shepherd Pratt as we gather to celebrate Howard County government's commitment to meeting the critical behavioral health needs of its residents. I would like to thank County Executive Ball for having us today and continuing to prioritize the development and expansion of critical behavioral health services in Howard County. Thank you so much. I also want to thank the state for supporting this program and its commitment to ongoing public fee-for-service funding for these crisis beds, and as you heard earlier, all these important pieces of legislation for behavioral health. Thank you so much for your leadership and dedication. In the wake of COVID-19 pandemic, the need for behavioral health care services nationwide has increased, and here in Howard County, it is absolutely no different. The investment will allow us to meet the increased need by operating a 16-bed residential crisis service program on our Baltimore, Washington campus in Elk Ridge. I would urge all of you to come and visit. It's a beautiful facility, and it's an exciting opportunity to expand these programs. Shepherd Pratt operates residential crisis service programs across the state, where our goal is to help individuals in crisis transition back into their communities and environments as quickly as possible. These programs are diverting hospital admissions, reducing the length of patients' stays in the hospital care, and providing a step-down option for patients ready to discharge from a hospital setting, and creating more positive and fulfilling experiences for patients experiencing mental health crisis. And as you heard earlier, this program is important to help divert folks from using very important emergency room space and being able to get them the right care at the right space at the right time. Within each of these programs, intense around-the-clock psychiatric care is available in comfortable home-like setting for patients diagnosed with a range of mental health and addiction needs. Residents of our residential crisis program receive intensive personalized services, including case management, counseling, medication monitoring, skill development, illness management, health coordination, and assistance in finding permanent housing, and hope that they never actually have to ever return to an emergency room again. I would also like to recognize the great work being done by Howard County General Hospital and Turk House to meet the behavioral health needs of Howard County residents. Together with the support of the County Executive Ball and the Howard County government, we will ensure that Howard County residents get the right level of care that they need at the right time in the least restrictive and least costly setting. I'm very excited about this. Thank you so much.
Hello, everyone, and good morning. Thank you all for coming out in this very cold weather. Once again, we'd just like to thank the County Executive Board and all our state stakeholders for coming out today. County Executive Board, on behalf of the Turk House organization, I'd like to thank you for your diligence and leadership in providing an avenue for organizations such as Turk House to help mitigate the challenges we face as a county in the ongoing battle against the disease of addiction. Thanks to you and the Howard County Department of Health, Turk House has been a fixture of hope in the community in providing much needed residential treatment for services to the county's residents. Today's announcement marks the dawn of a new era, allowing the county to hone in on long-term residential treatment services for pregnant women and women who are struggling with the disease of addiction. Pregnant women and women struggling with this disease are in need of services and not criminalization. The addiction and overdose crisis, which now claims more than 100,000 lives a year, shows little to no sign of abating. And emerging data highlights a startling impact on pregnant women. Overdose is now the leading cause of death during or shortly after pregnancy. Recently, Columbia University researchers reported that drug overdose deaths among pregnant women and postpartum women increased by 81% between the years of 2017 and 2020. In September of 2022, the CDC released data showing deaths related to mental health conditions, including substance use disorders, account for 23% of deaths during pregnancy or the year shortly afterwards. And so this collaboration with the county and governmental state representatives really go a long way in helping mitigate the challenges we face as a county. And Turkhouse, for one, thanks all the partners that we have here today who are diligent in making sure that we can help combat the disease of addiction. And so once again, we would like to thank County Executive Board once again, and of course, Councilwoman Debbie Young for your efforts, your diligence, and your tenacity in making sure that Howard County is at the forefront to help fight this opioid crisis that we have on our hands. Thank you once again, and we hope to do more business going forward together.
I want to start by thanking the County Executive, Dr. Ball. Thank you for having us. Thank you for your partnership, for your commitment to supporting these important behavioral health initiatives for our residents. The Howard County Health Department works with all populations in the county who are struggling with mental health and substance misuse. Our behavioral health navigator and peer support staff link those with help to harm reduction, to treatment services based on where they are in their recovery process. An expansion of mental health services has been a strategic goal for the Bureau of Behavioral Health and the Howard County Health Department for quite some time. It's exciting to see this come about and continue to progress. This additional funding provided by the county allows us and other agencies to make additional referrals. It increases the access to services to help those clients and families in need. If you or a loved one are struggling from a mental health or substance misuse challenge, contact the Howard County Health Department. We can connect you to the appropriate behavioral health resources. If you or a loved one are experiencing a behavioral health emergency, please call 988 to receive 24/7 crisis support services. Thank you.
I'm just so excited to be here because of what potential we have before us. Dr. Ball, your budget and your leadership consistently has shown us that we can be healthier here in Howard County when we choose to be healthier in Howard County. The dedication of the council, the dedication of our state delegation, and the leadership of all the community partners out there to make sure that we have what we need when we need it to address mental health needs, substance use needs, or any sort of health needs that we have is something that makes me proud to be living here in Howard County. For the past 7 years, we've been doing a lot of work together as a community to try to make sure that we have community ability for people to go get the help that they need so that they don't have to unnecessarily go to the hospital. We've been doing things like teaching people to be emotional support humans. We have expanded school mental health supports to all 77 schools. We've created a regional partnership crisis system to make sure that we have somewhere to call, people to come and respond who are trained, and of course somewhere to go. We've invested in urgent care at Shepherd Pratt. We've done work with Turkhouse and others, and we have all of this potential ahead of us. I guess the key thing that I want to say in closing here is we look forward to the day when Howard Countyans get the right level of care that they need when they need it. We deserve that sort of opportunity here in the county, and with the leadership that we have around us, we're going to be able to get that. And lastly, we're proud to have partners like Howard County General Hospital, like Shepherd Pratt, like the Turkhouse, who we know are giving compassionate care to residents when they need it. This is hopefully the beginning of a lot of work ahead. In order to really address this problem, we need community supports, we need urgent care, we need inpatient care to make sure that we round the continuum so that people get the help that they need when they need it. Thanks so much, County Executive, for your leadership, County Council, delegation, partners, everybody's here. Look forward to a lot of days of great work ahead.